Initial assessments in private MSK practice are pivotal in women's health as well, in peds, you name it. They are so important because they ultimately determine the patient journey. When they're done right, they build trust, they motivate our patients, they secure commitment to the treatment plan. But mastering assessments really does present significant challenges. And I know this as a clinic owner, as a clinic lead, as a physio, as a coach, working with lots and lots of people like you, our listeners, on their team and their team's performance. So we find that multitasking creates this massive time pressure. There's so much to do with such limited time that these are very rushed appointments, information gaps, compromises quality care. They have low value first sessions. Traditional assessments often consume entire first sessions, all the talking and no actual action. So they have often disappointing patient experiences. And we have this inconsistent service quality then, an unstandardized approach that creates a variable patient experience and care quality gaps across different experience levels. Today's episode is going to show you how you can plug this gap. And we are going to be talking to Paul from Go Clinic AI. And Go Clinic AI modernizes MSK practice with seamlessly integrated AI. It's so exciting. It's AI-guided pre-assessment, so it shifts history taking to the pre-appointment, creating this 15 minutes plus for higher value care. It standardizes practice excellence. It gives you much more diagnostic confidence. It enhances that first session value, and it creates automated documentation. So without further ado, let me get Paul onto the episode, into the podcast, and for him to explain to you a little bit more about how this works, how it can completely transform how you work in your clinic and really optimize patient results. Welcome to the Treat Your Business podcast with Katie Bell. I'm Katie, and this is the place where clinic owners like you learn the strategies, tools, and mindset shifts needed to transform your clinic into a thriving business, one that gives you more time, more money, and more freedom. Born from a passion to challenge the idea that average is normal, we empower clinic owners to create extraordinary businesses, incomes, and lives. Through our world-class coaching programs, we help you step out of overwhelm and into confidence, turning your clinic into a business that fuels your lifestyle, not draining it. So, are you ready? Let's dive in. Today's episode is sponsored by VBS Medical Limited. It's the exclusive distributor of K-laser therapy and Indiba radiofrequency therapy in the UK and Ireland. K-laser and Indiba are non-invasive therapies that enhance and accelerate the healing process, complementing standard of care, broadening therapeutic opportunities, improving clinical outcomes, generating new profit and distinguishing your clinic from the competition. K-laser and Indiba have a medical device regulation approval, meaning they have scientific publications to validate their clinical applications in practice. To learn more, visit www.vbsmedical.com and book your free trial today. Hi, Paul. Welcome to the Treat Your Business podcast.
Hi. Morning.
Thank you for being here. I'm always really excited to interview guests like you, but I'm particularly excited for this because I think this brings in so many elements that we talk about on this podcast, from kind of client results and facilitating great outcomes, from building retention rates, improving conversion rates, supporting our clinicians in doing a better job of getting out of their, for want of a better word, NHS head and into our private head. And this product that you're here to talk about, Paul, brings all of this together. So tell the listeners who you are, what has led you to develop this that we're going to talk about today?
Yeah, great. Thanks for having me here, and your listeners may be interested in AI. So yeah, I'm Paul Baker, physio, been qualified nearly 30 years, 97. And the reason I decided on physio is it just suited me down to the ground. And father had his own business, so been around family businesses since day one. And yeah, so it was a great way to obviously qualify as a physio and get involved with helping people. So made a beeline straight from the NHS, a year in junior rotations, was working privately in the evenings, and yeah, full-time private within 2 years. And obviously Yeah, been learning ever since, working in other clinics, picking up the good bits, and then obviously putting that into our own and building from there. Fast forward to now, we've been our own clinic for 20 years through various guises. Currently have a standalone freehold, 10, 12 employed clinicians, all self-funded patients, don't deal with any insurance, been self-funded for 5, 7 years. So obviously we position top end for a reason, to be able to add top quality service and value. And that starts in the treatment room or even before, website, first impressions. So this product builds on all that experience from 30 years of trying to train clinicians, what's important in the treatment room, balancing that clinical with commercial, because ultimately this is a private practice product. It's all about freeing up time in that first session to just provide value, basically. And the more value you provide, the more expectations the patient you satisfy. Tick, tick. It's a no-brainer when you're making your recommendations to the treatment plan. So yeah, this is an AI product that, starts before they even attend the clinic. So already you're differentiating as an innovative, patient-focused business. And yeah, it's just stacking value from day one, giving them that opportunity to take their time and tell their story, which you will then build on as you see them in the treatment room. So yeah, that's where we are.
It's so exciting. And you just talk about it so nonchalantly. I've just designed this thing now in my spare time, and it's just phenomenal what we're about to hear. But Paul,
Oh, thank you.
if we think about the challenges that our clinic owners have, the clinic owners themselves have it, but then we've also got clinic owners who listen to this who have team. And we won't get on soapbox about the newly qualifieds that are coming through and the lack of jobs that we're seeing in the NHS and how much they're now looking at to private practice for us to be able to take them on that next step of their learning journey. But the things that I hear a lot are people, so from the business perspective, people struggle with the conversion of new patient to follow on treatment. And as a clinic owner myself with team, one of the biggest challenges we often hear is that they're trying to over deliver in a session. So they want to assess everything they possibly can. The assessment takes too long. The chatting takes too long. They prioritize, I think, often the wrong things in an assessment. And I'm always talking about quick wins with patients. And sometimes when I say that, I feel like maybe some people might think that I'm just trying to cut short assessments. And I don't mean that.
No.
I say that for me, and this is, I'm qualified too many years to remember now, but I always think an assessment is not a one-time thing. It's a continuum that happens throughout every session. And we don't have to assess everything in that first session. We want to build those quick wins. So we then have team that are running over time, grabbing the patient's notes as they come out the door and go, maybe we could see you again in like a few weeks. And it's all rushed. There's no conversation in the clinical room because we haven't got time, because we've assessed too much and we've not had enough time for treatment. I think that most patients expect treatment on their first session when you come into a private practice.
Yeah.
I don't think physios deliver enough of it because we're too obsessed with assessing everything.
Yeah.
And trying to aggravate everything rather than look at what eases stuff and how we can get people to that quick win quicker.
Exactly.
So all the things that I see, these are all the things that I hear. And then what we have is clinic owners saying, oh, our conversion rate isn't where it should be because we're not giving the patients enough time in the session to explain what we think is going on, how we think we can help them, and what the journey looks like moving forwards. So they've got that challenge. The retention rate then tends to be poor because we're not getting the quick wins soon enough and the clients haven't got the confidence in us. So I see it from this business point of view, and we also see it from the outcome of the client. So how does this product, this AI product, solve some of these challenges for the clinic owner or managing team and possibly not performing in the way that they want? And how does it then optimize what the clients are getting from us and ultimately influence our profit levels at the end of the day?
Yeah, exactly. When you look at any innovation, you can just do simple task replacement. So voice to text notes, it'll take the recording.
Yeah.
But that's level one. So This is like deep looking at all the problems from all the stakeholders, patients, as you said, therapists, clinical leads, business owners, and then looking at the system, the assessment model, and redesigning it with AI built into it. Yeah, the problems would be obviously the initial assessment. My personal opinion, humble opinion, is now with AI, it's outdated. I've been using this in the clinic now 14, 15 months. Team been using it a year. So obviously it's a bit of an getting used to upskilling. Yeah, it just reduces that. I call it the sort of multitasking, cognitive overload, juggling act, just that time pressure. Yeah, taking a stranger from the reception through introduction, clinical, yeah, connection, rapport, explaining the diagnosis, treatment,
Yeah.
followings. Yeah, so in clinic, we've had a system we call the patient-centered charter, which is like 8-step nail session one. If you get 5, 6 patients wowed anyway, but yeah, this is building on all that to basically streamline that and offload the sort of lower value tasks. And I don't mean the subjective is low value.
Yeah.
I mean just a lot of the routine question, we could, with our skills and knowledge, we could use that time more wisely, that critical first session time to really amplify the value for the patient. Yeah. Because what happens then is, so clinician, obviously, as you say, lengthy subjective, irrelevant questions, not really sure what they're looking at, just general speaking, obviously. Yeah. So they do a lengthy assessment, as you said, yeah, which confuses them even more because they don't even have the sight or spread of the pain adequately marked out. They might have P1, 2, 3. They merge them together. They're not clarifying state at rest when they're doing objective tests. It's just a jumble on the page. So they have to test everything. And then they're all confident with their explanation. And I'm talking generally, obviously. But and then that feeds into the patient. So what's wrong with me? I think it might be possibly this could help. So as a customer in any business, you went into somewhere and asked for an opinion and that message, you would sit on the fence a bit, wouldn't you? So it's like basic behavioral science, connecting with people and delivery, but that's obviously built skills. So where there's a gap in that, obviously the quite focused, everything's clinical, ignore the customer. So this helps regain some of that time, a good 10, 15 minutes in the initial. So I explain a bit about the product as I go.
Yeah, let's do that because this, I really feel like I want to know more now about it.
Yeah. So basically, when a patient books an appointment, we're integrated with Nucal or Clinico. Receptionist doesn't have to do anything on the setup. It's for a diagnostic service, obviously. So and musculoskeletal assessments. Could be if you got separate appointment types for EPLEs or discovery calls, anything where you want a history, really. So you set that all up in the back end, very straightforward. Most of it's automatic, but then make an appointment, email sent directly. They get 3 reminders over time between booking and appointment. And then when they basically takes them through an AI guided subjective assessment, it mimics the subjective. So the way it works is obviously, a lot of the sections, yeah, it's within guardrails. It's all very strict, yeah, questions. And it will choose the best follow-up question based on the patient's sort of answer, as you should be doing in clinic, really.
Yeah.
So it analyzes the answers, choose the best follow-up, and then automatically writes it up into subjective notes, ping into Clinico or Nucal patient notes, there for you to look at before the assessment, which is highly valuable. Even if you don't look at it, having that there, that obviously forms the whole structure. Then obviously patient comes in and, hi John, nice to see you. Come on through. Thanks for filling that form. Saved us loads of time, loads of really valuable info there. Saved lots of time for treatment. Yeah, and they're just like, great. Because they've been waiting. Obviously, the different patients have different stories, but some of them are waiting months on waiting lists and different opinions. Some are even years. Some are just instant. But once they've decided, regardless, they want treatment basically. And when I say treatment, I don't mean like always hands on. They just want value. Yeah. They just want you to use your expertise to help them solve their injury problems and concerns. You know what I mean? Whatever way you decide that to be, but it gives you an extra 10, 15 minutes of time in that initial to wow them, basically, providing lots of benefit. So the conversion is, they'd be foolish not to.
You mentioned a stat, Paul, before we came live, which was 58% of patients expect treatment within their first session, and 22% or less actually get it. And
Yeah, yeah, that was your CSP stat, I think.
was it? And I think that's amazing, because I was shocked that it was 58, because I would have guessed it would have been more. And
Yeah,
from the patients we see and how much they value treatment, whatever treatment plays. However, and then I thought, when 22% actually get it, I know what I'm like if I'm seeing somebody, or you go to the doctor or whoever, you just want, get the questions done and then just give me the solution. Give me
yeah,
what you think we need to do to move forwards and get me out of there. That's what we want. And that's
yeah,
playing in the clinic room, isn't it? We want to leave feeling better than we arrived. And I think sometimes we run the risk of patients being so overwhelmed with everything that we're asking them,
yeah,
and everything that we're then telling them as a result of what they're telling us,
yeah,
that they don't often leave feeling better physically or emotionally or mentally, because they just leave feeling, I'm not exactly sure of my plan, I'm not feeling that confident, I haven't
yeah.
really had the hands-on treatment that I expected. And that's when you see this drop off, I think, of people that might book and then cancel, or book and don't turn up. We see that drop off happen, don't we?
Yeah, yeah. So we've done a fair bit of internal research just with our client base, and I have the results, and I do need to get them out there. But yeah, until you start looking at this, you don't realize people are anxious coming in
Yeah.
to physio. They're worried they'll forget something important. That's the stuff feedback we get.
Yeah.
Um, they obviously really value the opportunity to provide the history up front, where they're training them how to give you accurate information even before they attend. The key is our job is practical. So you really have to practically use something like this to experience it. Words alone will not change behavior. So yeah, and different patients will get different value from it. Obviously, every patient's different. Clinicians will get different value, different clinical leads. What we do is complex. So this is about just unburdening and helping set the trajectory, because it's critical. So, then when patients you're training them how to give you good information. So then they come in and they say, oh yeah, I forgot. Yes, 2 days have passed since they filled it in. I want to tell you this. So they're giving you even more detailed info before.
Yeah.
Exactly. So yeah, when they come in, then obviously you would still verify the info. It's only a questionnaire, but we've got some programming analysis mimicking best practice models in clinical reasoning, to then, from all the information, make an analysis, a clinical analysis, to just help support second opinion if needed, basically.
That then guide you, Paul, in terms of, you've got your subjective, you scan over it before you see the patient. Is it then giving you indications of what are the 1, 2, 3 things it could be? Does that then form more of what you need to go and then assess from an objective point of view?
Yeah, it will, using best practice clinical reasoning models. Yeah, an experienced clinician, even from a body chart. So it's an interactive body chart there. The patient will fill in. That will link to what structures refer into that area. Then you start analyzing with the description, sight and spread, depth, frequency, agonies. A good clinician, you could probably narrow it down to top 3 with just a good body chart. Yeah.
Yeah.
So it's getting the less experienced clinicians, oh, this is how useful a body chart is. You know what I mean? It's that scaffolding, because the amount of times I do all the training in the clinic. Communication is key. Subjective is fundamental practice. And tell them 6, 7, 8 times in different training sessions, a body chart, you can diagnose from that. We play little quizzes and stuff. You do a case review. Where's the body chart? Yeah, honestly, a picture tells 1,000 words. For the clinician and patient. Think about session 4 or 5, they've improved. So I would update body charts through the course of treatment. And then you can say, oh yeah, they come in, how's it been today? Oh yeah, no, it's just been a bit worse since last session. Oh, yeah, you talk through it. Actually, they overdone something. So where's your pain now? Okay, let's just compare when you came into where you are. Oh, yeah, wow, yeah, no, it is really good.
Yeah.
You know what I mean?
And that's a big challenge, isn't it? Because patients forget week to week how bad they were when they first started with us. And so it's always great to be able to go back to this is where
Yeah,
we were, this is where we are now, this is where we're going, and always be able to reflect on that. So the AI does a lot of the analysis
yeah,
and that side of it for you. You then have more time to do your hands-on assessment or
yeah.
whatever you're looking at.
Yeah, let me talk you through what a session would look like. So the patient would still tell their story. Yeah, let's just fill in a few of the gaps and start a subjective. So yeah, it says here, you strained your back a few weeks ago. Just tell us about that. Open questions, all the same principles. And they'll still talk. You got the info there. And it's not like you're not reacting and
Yep.
it's that
Trying to write everything down.
yeah, in the middle space with, oh, it could be this, could be that. Yeah, you got pretty clear where it's going, but obviously you're probing. And yeah, often, ultimately, it's a questionnaire, a smart questionnaire. And the analysis is probably as accurate as any clinician could do on that questionnaire info. But you're the expert in the room. It's a
Yeah.
starting point, and you layer in your expertise as you see fit. And then you get to a much, much better place, much quicker, deep understanding, patients giving you more accurate info, and then you got a much more focused objective, and then plenty of time to treat the value and the treatment plan and what the coming weeks are going to look like. So it's not that last minute at the desk.
I hate that. When they're like still trying to do the shirt up, are you trying to get them out the door because you've got your next one and you're overrunning? And we've all been there, haven't we, Paul? We've all been there.
Ultimately, it's about standardization and quality control. Then, from a business owner point of view,
Yeah.
trying to standardize that initial patient experience so it adds value.
And that's really great because the conversations I often have with clinic owners, I want you to imagine that your business is like a McDonald's and each treatment room is a different franchise.
Tell me about it.
So I don't want to go to treatment room one and I'll order a hamburger and then go into treatment room two and order a hamburger and my hamburger is completely pretty different. It should, it, yes, you have freedom of how you treat, how you work, how you clinical reason, all of those things. You're individual practitioners working in your own scope of practice and you've got that autonomy. We have to standardize what is going on behind the clinic room door. And as a clinic leader, as a clinic owner, we need to know when that door shuts, they're going to get a process that they go through that is very similar, if not the same, to what they would get in treatment room two with James or treatment room three with Helen
Yeah.
or whoever it is that's working
Yeah.
for you. So
Oh,
it
totally.
really helps that as well, doesn't it?
Oh, totally. Yeah. Because you know yourself and your listeners will be doing case reviews when you got half the information. It's like less experienced clinicians think you got a magic wand you can just wave and oh yeah, that's what it is. But it's like I can't make head nor sense of that. So tell us, what does that mean? So all they do from a case review, you're like trying to find out what's going on. They're then leaving with a list of questions.
Yeah.
Usually case reviews obviously could be first session, often third, fourth, when they're sort of patients, can sense they're going to self-discharge prematurely. What's going on? I'm not sure. And then they're going into that next session with a list of questions. Patients like, oh, I'm having a reassessment now. And yeah, they're gone. You've lost them already. So it's not reactive, it's proactive in advance, standardization for setting that trajectory for the patient's recovery, that buy-in. And yeah, obviously a lot of it is biopsychosocial. So all of that adds to it massively.
Yeah, this is great. Paul, we like to give our listeners loads of value, and I asked you for some top tips
Yeah.
that can help master a really valuable first session. And some of the stuff we've already talked about, but number one tip was, and I'm just reading my notes here, shift your assessment mindset. So seek relief, not just pain. And this really resonates with me. So help me understand what you mean by that, because I think we over assess and we are looking to aggravate stuff all the time rather than find ways of what relieves symptoms and how we can get the patients those quick wins. So what do you mean by shifting your assessment mindset?
Yeah, a lot of the times we're taught, is that sore? Is that sore? Is that sore? Positive, yeah, can. That's the diagnosis. So now, how do I treat it? Whereas, depends on the condition, obviously. Like a torn calf, everything's going to be painful. Nerve impingement, yeah, you do not want to be aggravating that. You want to be looking at things that's going to ease it. Does that ease it? Does that ease it? Does that ease it? Because then, very simply, that becomes those positions, those activities that then flows into your obviously treatment approach with some techniques and positioning. If it's compressive, you gap it basically.
Yeah.
Uses their referral, quite straightforward. But then it's also the positions at home, it's the activities they do, it's the hobbies they avoid and can do. So yeah, if you just go on a pain, oh yeah, that's positive. You just got a load of question marks then with how to actually treat it. So yeah, patients respond to that as well. If you're there assessing them and you're easing their pain, it's like just adds to their trust and confidence and buy-in.
Absolutely. Your second tip was assessment flows into treatment. So I think certainly when I trained, it was like you do your subjective and you write everything down and then you stop and then you do your objective and then you stop and then you go into treatment. If you have time, you probably don't. And then you go into your plan with them. And it feels really like rigid and not flowy and not great. And so your second tip was how your assessment and treatment can flow into each other by using this AI and it will help you do that. Can you explain that a little bit more, Paul?
Yeah, yeah. Obviously, it's back to that. Oh, right, you've assessed them. This is the problem. This is the treatment we're going to do. And then all of a sudden, you've hypothesized a snag or a mobile movement on C2-3 is going to increase rotation to the left, and it doesn't. Well, you've set yourself up for failure. Yeah. Patients instantly, he said it would work, and it didn't. It's all psychology. So you just up and down the articular pillar, you're just doing mobile movement as part of your assessment. I do that instead of palpation, seeing what levels improve, and then that's your treatment. And you know it's going to work. You get confidence then, rather than putting it all on paper, working it out in your head, because it's practical. You can do that many ways. And so mopes with movement being one. Obviously, the whole McConnell's taping thing, I don't know where you stand on that.
Yeah.
For some patients, it's good.
Yeah.
That's part of my diagnostics. Is it infrapatella tendon? Is it more patellofemoral? Let's pop the infrapatella brace on and see if it eases their single leg dip. You're doing that at the start of the objective. You're just arming yourself. Yeah, it doesn't. Okay, it's probably more patellofemoral. Let's measure. Let's see. Let's that way. Does that help? Let's see the dip. Oh, good. That's
Yeah,
obviously,
you're using your treatment to help form your assessment better. But rather than it being a rigid two-part thing, it's just one is flowing into the other and
yeah,
you're able to use your time much more effectively and patients instantly are feeling those quick wins because they feel immediate relief or
yeah,
improved confidence goes up, trust level goes up.
yeah. Like with a root impingement, manual traction, be it cervical or lumbar, stayed at rest, 3 out of 10. Hold it. Does that ease it? No. Okay. Double leg. No. Might be the position. Let's get you prone. No. Let's pop a pillow under your hips, getting you a bit more gap flexion. Does that ease it? Yes. You just got to go that deep with it, basically.
Yeah.
Like, yeah, you'll just conclude incorrectly,
Yeah.
and then you think it doesn't work. And
Yeah.
then you live an opinion that none of this works. You know what I mean?
Yeah.
That a lot on social media and
Yeah,
stuff.
absolutely. And that forms your third tip, which was show off your expertise with your quick wins. And that's exactly what you mean there, isn't it? There's ways that you can incorporate treatment into the assessment that instantly, immediately changes symptoms, reduces them, relieves them. And
Yeah.
that instantly builds that trust factor, which could ordinarily take weeks to build up if you're being very rigid at this approach to it.
Oh yeah, totally. Because if you, yeah, the opposite. It's like the length of time you leave between an assessment to treatment. If it's, I've looked at stats. If it's longer than 5 days, that's like the biggest predictor of self-discharge. You know what I mean? A, the patient's not committed. They're sat on the fence. B, they're making excuses. C, when they come back, if you've got a busy list, you ain't going to remember them from Adam. You have to. D, they'll have more opportunity to aggravate it in between. E, psychologically, we are trying to change behavior with all these overuse injuries. That'll be the majority we see rather than the simple trauma. So that means that behavioral change. If a psychologist was trying to work with a client on behavioral change, how many sessions would he do?
Oh,
And they'd be an hour long, wouldn't they?
yeah. And they'd be all in much more quick succession to start with. Whereas we're going, it's 2 weeks. What?
So, yeah, you got to train people to get better, basically.
And so your fourth tip is train patients how to get better stop method. So this is about, I love this, what you said, patients spend less than 1% of their week in your treatment room. That's crazy.
I know. Yeah.
That really blew me away, because it's the same when you're thinking about dieting or exercising or trying to do the right things. The proportionate time that you give to those right things tends to be very small in your whole week. And then we wonder why it's taken us ages to lose weight or ages for us to get fitter or whatever. So
Yeah.
you're saying it's crucial to teach them how to stop aggravating their symptoms, start easing them with self-treatment techniques, but then being able to, and I talk to my team about this a lot, we have a rapid recovery program. And what really that is all about, they buy into 5 sessions. It's after their initial assessment. But those first 2 sessions after the initial need to happen within a 7 to 10 day period, no longer. Like, we want them in. I want to do an initial assessment, treatment, and if I could have my way, 2 days later, I'd want to see them again.
Yeah, totally. Because even if you didn't do any hands-on, you got so much value to add. Yeah. And when you have lots of value to add, you can see them like quite frequently.
Yeah. And also, I think I'd made up this stat, Paul. This has not come from anywhere but where I had. If you have an initial assessment, clients remember about 25% of everything that you said, and 75% of it is gone. So I always say you could do 75% less and still get the same outcome.
Yeah.
And they're like, oh.
That is 10%. They forget within a day. They retain 10% within maybe, I need to look at that. 4 days, 5 days. So,
research on this.
Yes.
And then if we leave them 2 weeks, by the time they come back to us, they're now making up exercises that we never told them to do, or they've got their own variety of exercises that you think, did I tell you that? I'm pretty sure I didn't.
And that's where we're really good subjective. So this just enhances your subjective. This doesn't replace. This actually gives you more time to focus on the deeper skills rather than as the basic joke about it. Has anyone in your family ever had osteoarthritis or any degenerative disease? You know what I mean? I stopped asking that like 20 years ago. I think some people do, you know what I mean?
Yeah.
It's relevant. And that's where this is for private practice. Our patients shape our practice. Obviously, this isn't relevant for that population. And we're all motivated to fill in the form basically, and they get the value then. And that's the key bit. You're adding that value. So when you've got way more detail in the subjective and you've built on it, then stop aggravating it, because it's all clinical then. It's the patterns. Start doing things to ease it. And then that just amplifies the effectiveness of your treatment. If they're just aggravating it in between sessions, no wonder it doesn't work. And again, you have to go deep on that. I've got an orthopedic pillow. Okay, bring it in next time. Let me have a look at it. Because we all know there's lots of different types and lots of different neck sizes and lordosis curves, and it may not be suitable. So
I think a lot of what I hear, Paul, this is just reminding me, is you'll say to them, so have you been doing anything different recently? Have you done anything, have you changed footwear? Have you changed your desk setup? Have you bought a new car? Have you changed your bed? No, I can't think about it. Have you painted the ceiling for the first time in 6 years? Have you?
Yeah.
And then you dig a bit deeper, and eventually at some point they tell you something juicy, don't they? Where they go, oh, I wonder if it was when I shoveled the snow off my drive for 45 minutes the other night.
Yeah.
Okay, so now we've got some possible mechanism of injury, but we've also got a bit of a backstory of what you've been doing that might have been built up. The shoveling the snow wasn't the thing that has done it. It's just the cherry on the cake. That's the straw that broke the camel's back.
Yeah.
You've got longer time to fill in a subject. When you've got like that moment of, I've got to fill this form in from a physio, I've got a bit of thinking time to be able to say like, oh, I want anything different this week, or what In the moment when you're in the room with a patient, they often can't think because they've just raced here from work or they've got something else going on. So it really allows them to think through
Yeah.
their lifestyle and those things.
And the population of patients certainly we're seeing are a lot more complex, I would say, since
Yeah.
COVID. They're not, we're often the first clinician they've seen face to face in a long time, and stuff that would normally get picked up. They come in with multi-site pain or more complex sort of chronic conditions or even red flaggy. We're seeing a lot of that now.
Yeah.
So for different patients, you'll get different value. And for different clinicians, a junior, it's all about quality control, standardization, teaching them the systems, the framework for great subjective to then give them the time for that more enhanced clinical reason and patient value so they can succeed in private practice. Because, yeah, with this system, we just employed a new grad like 2, 3 weeks ago. Without it, I'd be nervous. A, it means be a baseline standard, and B, we'll have the info that then we can do decent case reviews with the clinician to help them
Yeah.
straight from session one and can set, because the worst thing when you get new members of staff who maybe aren't used to the private sector, adding the value, different philosophies, they just hemorrhage patients basically, and the whole clinic goes quiet. I'm sure you've experienced that before.
Yeah. Absolutely. But going back to the point we made right at the beginning, we've got a job crisis again. It's this whole, when I
Yeah.
qualified, there was no jobs in the NHS. There was 2000, when did I qualify? 2008. There was this like, everybody had been moved from band 5 to band 6, and band 7s have gone to 6s. So there was no rooms for 5 to go up. And there was just this hundreds of unis churning out 100 and 120 physios a year with zero jobs. I had to go and get a job in the university for a year. And then we've seen this cycle come through again. And I think near you, Paul, I was talking to Fiona yesterday. She was saying how many institutions you've got. And there's 2 band 5 posts available.
Yeah. No.
It's frightening.
Once I qualified,
Yeah.
Queen worked. So yeah, well, there's a lot out there that just will be lost from the profession if it goes on too long. So
Exactly.
new grad we employed was a great attitude, obviously good communication skills, and yeah, she'll be a good physio. She'd been qualified actually last year, so she had no job for 6 months, but still with this system, we had the confidence, the scaffolding to take her on and give her that opportunity. And then it means different things to someone like myself, a lot of experience, where you've got more time to add that value. Yeah, people think this is just for less qualified. It's even more valuable for more experience. Simple example, yesterday a new patient, lady, couldn't speak English, came in with her husband. So already for some people that would be quite challenging. Not a word of English, literally. Had all the info up front, chatting through the husband, plantar fasciitis, assessed her gait scan, explained she needed orthotics, done shockwave treatment, and she's booked in for orthotics on Tuesday. So that's from a commercial, financial perspective. That's taking what could have been really challenging first session to actually providing treatment and booked in. That's 2 sessions, that's revenue. So it gives you the systems to basically maximize the value.
It's incredible.
Solutions, basically.
Yeah.
You know what I mean?
So all these, because I'm super excited about it, that all our listeners are going to be, we've got small clinics, we've got big clinics, we've got clinics that have teams. So this kind of suits everybody. You are very kindly going to give people access to a 30-day trial of your product on full. How do they access them? What do they need to do?
They just go onto the website, goclinic.ai, and obviously there's various bits of info, what we discussed today. But yeah, there's a sign up for a free trial and just put in their details. And yeah, it's all automated. It should walk them through it quite routinely. But yeah, we also got support on hand at any point. All the contact details are there. Just email or WhatsApp. And yeah, we can guide you through the process. For those that want to see it in action first, we can do another button there for book a demo with me, and I'd take them through the system, just show them what it looks like and what the reports look like and the questionnaire. And there's also a dashboard then that you can manage the completion rate. So it sends out like 3 reminders. And then for those few that are too busy, and then on the morning of the appointment, like personalized, just very slightly template, really whacks the conversion up because, yeah, ultimately we want high completion rates, and we get on average 75% completion in clinic here, which is
It's huge.
pretty high when you speak to people. So, yeah, that's how they access it. And yeah, it'd be good to show them around and see what they think.
I would really encourage them to. And then if they decide that they want to do this, you've got a special 50% off a 6-month discount code. Am I right in saying that, Paul?
Yeah, yeah. So, yeah, thanks for having me on and opportunity to speak to your audience. So, with that in mind, obviously, we would like to offer discount 50% for 6 months post trial. And yeah, all they got to do is put in the code Go Clinic Thrive 50, basically. But yeah, we would flag them up if they do it automated, obviously, put in the code or chat through that on the demo.
Amazing. So the next step, just to be super clear, is go to goclinic.ai, the website,
Yeah.
book the demo or go for the 30-day free trial. And then if you love it, and I'm sure they're going to, they then can use the Go Clinic Thrive 50 code, and that will get them 6 months off at 50% 6 months.
Yeah, yeah. And the pricing is based on number of users. It's discounted the more users, tiered system. And it's all on the website there. And it's not as expensive as you would think. And the value, adds, yeah, worth it. I wouldn't be without it. Doesn't matter with the team, really.
Yeah. Paul, thank you so much for giving up your very valuable, precious time and your brain for our listeners. I really enjoyed this episode. Please come back again. Let's talk again in a few months' time.
Yeah.
I would love to continue this conversation. So thank you very much from me.